In an earlier module, we mentioned the importance of asking your NICU nurse about the best times to call and visit. In this module, we'll review some common questions that parents ask Amanda, as their baby's nurse. We'll then provide you with a concrete skill that you can use in the NICU to help you communicate with your baby's care team.
You might be asking yourself, how much should I be communicating with my nurse? How often you call and visit is totally up to you. Frequency varies across families. If you can't visit for the day, a call at the beginning of each shift to meet your nurse, and then once before shift change is a way to get updates that I think is sufficient. How often you visit the NICU will depend on many factors that you can't necessarily control, like how close you live, how much social support you have, your work schedule, and whether you have other children at home. Visit as much as you can and want to. Some parents feel most at ease when they're physically present in the NICU, while others need to take some time away. I recommend honoring your specific needs at each moment. You may also wonder, what should I be asking my nurse? Usually, the NICU team weighs your baby once a day, so you can ask for your baby's updated weight. You may also ask, did any medications change? Did we adjust my baby's feeds or respiratory support? Did my baby have any significant B's and D's? And if you can't be at rounds, what would you like your nurse to communicate for you on your behalf with the rest of the care team? This can give you a picture of how your baby's last 12 to 24 hours went and what to expect for the upcoming day.
Sometimes communicating with providers in the NICU can be intimidating or even anxiety-provoking. You might be telling yourself, well, they're the professionals. They probably just want me to stay out of their way.
Which is not true.
You may feel frustrated that the nurses are doing so much for you, angry that they aren't showing you how to do specific tasks for your baby, sad if you perceive there's not enough space for you at bedside, or even envious that the medical staff gets to spend so much time with your baby.
We want to provide you with a tool that can help you communicate clearly with any staff member when you have a specific objective in mind, when you know what you want to say, ask for, or communicate. Being clear about what you want before you initiate a conversation helps facilitate effective communication and garner support. For example, do you want something to change, help from another person, to say no to a request, to be taken seriously about an opinion or position? Once you're clear about what you want, use the acronym Dear Woman to support you in communicating effectively.
Let's go through an example together. The nurse feeds your baby at the same time every day, which is coincidentally the time that you're consistently in the NICU. The nurse hasn't asked you whether you'd like to feed your baby. You feel scared to feed them on your own. They look so small and fragile. You know you want to try, and you're worried about hurting your baby. It becomes clear that what you want is for the nurse to show you how to hold your baby, how to position the bottle, how to do what they seem to do so effortlessly. Let's start with the dear part of Dear Woman.
D is for describe the situation. This orients the listener to what you're about to discuss. Stick to the facts and be specific. For example, you might say, I notice that you feed my baby every day at 12 p.m. when I'm at bedside.
Next, E is for express your feelings or opinions. Let the listener know how the situation you just mentioned makes you feel. For example, you might say, I feel scared to feed my baby alone. I also feel anxious about asking you for help because you seem so busy.
A is for assert your need and request directly. Stand up tall and avoid beating around the bush. Everyone has needs. For example, you might say, I'd like you to show me how to feed and hold my baby.
Lastly, R is for reinforce the other person. That is, identify something positive or rewarding that would happen for the listener if they give you what you requested. For example, you might say, I'll feel more confident and less scared to feed my baby, and it might free up your time at 12 each day.
So the dear part is the actual script, what you want to say. The woman part of Dear Woman is how you say the script. Let's go through woman now.
W is for willingness to tolerate not getting exactly what you want. Try to go into this conversation with some acceptance that you might have to negotiate a bit and meet in the middle.
O is for observe and describe. Check in real time with your emotions and body. Observe the experience, label feelings, and stick to the facts.
M is for mindful. Stay present in the moment. You may have had negative experiences with asking for what you need in the past, but this conversation is a new opportunity. Stay focused on the specific request at hand.
A is for appear confident. Remember that nonverbals are important. Stand tall, use an assertive tone, and maintain eye contact.
N is for negotiate. Be willing to give so that you can get if it's appropriate to the situation. For example, if there's any pushback following your request, you may ask, "What do you suggest we do to make this work?" This is a skill that can be practiced way beyond the NICU. You can use Dear Woman with anyone and everyone when you have a specific request in mind. For example, the NICU parents I've worked with used Dear Woman with their parents and in-laws to draw boundaries around visiting their baby, with their bosses at work if they want a promotion or extra time off, and with their partners every day. So, start practicing.